Hey, what's going on? I am Dan Sevigny, and you are watching Recovery X, where experts, thought leaders, and people in recovery meet to exchange information, educate the public, and help solve the problem of addiction. Today, I'll be talking with Gary Fisher, who is a psychologist and clinical supervisor at One Method Center in Los Angeles. Gary, what's going on? How you doing?
Good, Dan. How are you?
Doing great. Glad to be here talking to you.
Me too.
So I'd like to start off by asking you a little bit about yourself and what do you do over at One Method Center?
I'm the clinical supervisor over there, meaning that I supervise the clinical staff, uh, and that entails supervising people who are working towards their licensure, whether they're psychological assistants or marriage and family therapist interns, social work interns, and also do the case conference where we talk about the different people in treatment and how we're approaching their treatment. I also lead two groups a week there. One of them is a step group where we go through the steps, the 12 steps of 12-step programs. We look at the recovery principle involved in each step, as well as the dysfunctional or diseased principle, and how they can apply in everyday life beyond just addiction. And I also do what's called a process group, where we just start getting into some of the deeper issues that underlie addiction. Um, in that capacity, I'm available virtually any time for the staff to call me, to talk about different situations and give my suggestions for how to go about treating those people.
Nice. So you're kind of like the go-to guy, the leader of the staff over there, so to speak, as far as like the clinical side of things.
Well, the supervisor. So
Supervisor,
yes,
okay.
yeah.
Nice, awesome.
And then I also have my own private practice as well.
Nice, nice. So as far as addiction, what would you say is your definition of addiction? How would you define it? We got a great definition from Cassidy last week, but I'm interested to hear yours as well.
Well, I don't I go by the Latin. Addiction comes from the Latin derivative of addictio,
Hmm.
which means to essentially turn over or surrender to something. And there's a couple other definitions. I think it's Random House or one of the other dictionaries defines it as being enslaved to something.
Hmm.
And so I view it as it's, I also look at the 12-step definition of a combination of a mental obsession in terms of physical addiction, like to drugs. It's a physical dependence depending on the substance being used. But there are behavioral addictions where things are happening in the brain that mimic what happens when people use drugs. So in the brain, I don't know that the brain can tell the difference between necessarily a cocaine high or a sex addiction high or a spending high.
Oh, interesting.
It all registers pretty much the same. And they've done a lot of these tests where they'll be monitoring somebody's brain and seeing what centers are activated when they see images of their addictive behavior or substance. And pretty much the pleasure centers in the brain are activated in the same way. So it's just a lack of choice. People who are addicted no longer have a choice. They
Mm.
must do certain behaviors.
Yeah. That's a great definition for sure. So what would you say is the main cause of addiction in people? How does it come about?
Well, my philosophy is that, um, and I use the term dis-ease, 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 that whatever the reason, people disconnect from their center, from who they are, mostly their emotional self. So whatever's going on in pre-birth, birth, early childhood, um, their they're experiencing feelings that are just not, they're not capable of dealing with, and they disconnect from themselves,
Mm.
from their emotional selves. It doesn't mean they don't have feelings. It doesn't mean that they don't have reactions like other people do, but they're disconnected, and it doesn't really show up until later. One of the common things that people hear when they go to a 12-step meeting or go to a treatment center or listen to alcoholics, addicts of any variety talk is that those people pretty much from the first time they can remember didn't feel like they belonged or fit in anywhere.
Right.
They didn't feel connected to other people. They always felt different, separate, apart. And that's what I define as that disconnection. And so they're not really necessarily aware of it, but that's what's happening. And in that disconnected state, that is a very lonely, scary existence. And it's very, very, very uncomfortable. And so people seek things to get comfort,
Mm.
whether it be a chemical or a behavior.
Yeah, that makes a lot of sense. So you mentioned sort of like a trauma situation, right? That sort of seeds that disconnected feeling. We actually have a question here from Cassidy Cousins. In your 30 plus years of experience, how many people seeking addiction treatment have underlying issues of trauma? For those that have addiction and underlying trauma, what are the best ways to approach both issues during the treatment process? I think that's a great question.
Okay, so trauma is something that is talked about a lot these days, and for the most part, when we're referring to what we call big T trauma,
Mm-hmm.
Capital T trauma, that's something like sexual molestation, rape, witnessing physical violence with the threat of death, witnessing death. Those are all very traumatic experiences, whether those are natural disasters such as Hurricane Katrina or man-made disasters such as 9/11, or somebody killing somebody, being killed in front of you, whether it's a car accident, a murder, whatever it might be, situations where your life is threatened. These are all capital T traumas.
Mm-hmm.
And they definitely contribute to a disconnection from oneself because it's overwhelming. And then what happens is in those traumatic experiences, people become frozen. And they're in a frozen state where the HPA axis, the hypothalamus, the pituitary, and the this is the problem with being 66, Dan. The adrenal glands,
Yeah.
they're in an activated state, and they stay almost frozen in that activated state,
Mm.
which is why you'll see in trauma victims a hypervigilance of the environment. They're constantly on the watch. They have flashbacks and nightmares that keep them connected to that traumatic event, and they're not able to work through that in a normal way.
Mm-hmm.
Now, one of the most efficient treatments for trauma, which came about, I believe, in the 70s and was used extensively with Vietnam War vets and is now used extensively with just about any kind of trauma, is EMDR, which is eye movement desensitization and reprocessing.
Mm-hmm.
And that was discovered by Francine Shapiro. And what it does is normally we process things in our dream sleep. So when we're dreaming, we're processing out issues. And if they're normal issues, we just get to work through them and move on in our lives. People with trauma are frozen and they can't move on.
Mm.
So they're stuck. EMDR, which is whether it's through the eye movements, through sound, or through tactile things that we hold in our hands, they do bilateral stimulation, which means that it's stimulating one side of the brain and then the other side of the brain.
Mm-hmm.
And what is believed is that that helps mimic dream sleep. And it balances the hemispheres of the brain, allows communication between them, and people are able to then get unstuck or unfrozen from the trauma and able to move into a regular grieving and resolution. Then there's small t trauma,
Mm-hmm.
which can be anything from a lack of emotional attunement with the parents because they're really caught up in their lives. It doesn't have to be bad things. It doesn't have to be parents are bad or neglectful.
Right.
It's just the child is not feel emotionally attuned to. Maybe there's problems in the marriage and the parents are good people, but they're just not a good couple. So there's a lot of tension in the house, and the child absorbs the tension, believes that they're the cause of it, and so they start to think that they're bad.
Mm.
And if I get a little tangential here, just bring me back. But
No worries.
The problem is children, by the nature of childhood, are self-centered. Everything stems from them. Everything is them. So if I grow up in an angry household or a tense household, everything comes from me, so I must be the cause of that household.
Right.
And for an infant, a toddler, a young child, it is not palatable to believe that I'm in an unsafe, bad world. It's easier to believe that I'm bad. So I begin to internalize this idea that there's something wrong with me, something bad within me. Mm-hmm. And that causes that disconnection, because that's an untenable state to walk around believing that I'm a bad person.
Yeah.
So it's happening on a very deep unconscious level. And so that kind of thing, growing up with parents who maybe don't know any better and say things that they were told as a child, like you're stupid, what's wrong with you? This kind of wording, after a while, just creates a whole lot of negative self-talk of I'm stupid, what's wrong with me?
Mm.
And so that's the small t trauma that isn't life-threatening, but is very self-harmful. It's harmful to one's perception of themselves.
Yeah, that makes a lot of sense.
Does that make sense?
Yeah, absolutely. So would you say that all addiction starts in this way, either small t or big T trauma, and then kind of carries on into that disconnection, and then obviously into the process, that sort of repetitive cycle of drug or behavior use?
Yes, I do. I personally believe that all addiction comes from being disconnected.
Okay. So how do you go about the EMDR thing? Sounded very interesting. Are there any other sort of methods, and what process would you recommend for people going through this recovery process?
Well, in early treatment and early sobriety, unless the trauma has created such a state that one can't stay clean or stop the behavior without dealing with the trauma, first you have to stop the addictive behavior. Because as long as the addictive behavior is going on, you're just feeding the same old cycle.
Right.
So that's where treatment comes in. Treatment comes in that you get the person to abstain from their chemical or their behavior long enough so that you can begin to start looking at the underlying disconnection, the underlying issues, the low self-esteem, the negative self-talk, the lack of impulse control, and begin to address those. So, but initially, to start getting into deep trauma right away in treatment, personally, unless it's absolutely imperative because the person can't stay clean or can't stay abstinent, you want to build a foundation of some emotional continuity and consistency and regulation before you get into really bringing out some of these really painful issues.
Mm.
But
oh, go ahead.
But when you do, start to do that, EMDR, somatic experiencing, which is the use of the body, and we store a lot of feelings and emotions in our body. So it's use of body position, and a somatic experienced person will help move energy through the body. There's traumatic resilience model, which also helps teach people how to ground themselves, how to work with an activated state where they're physically and emotionally activated. And this is something that they help that person regulate a little bit more, because regulation is really one of the most important things. And one of the ways that I think is important that isn't necessarily talked about a lot in some of the 12-step programs is the physical regulation. And that's where working out, exercise comes in, because if you're going to take away the behavior or substance that makes me feel good, got to replace it with something that gives me a feel good feeling. So there was a study done many years ago. I think it was, I have the citation somewhere, but I don't have it off the top of my head, on the level of intrinsic endorphins and enkephalins in alcoholics. And endorphins and enkephalins are the natural opiates that the body produces, right? And the study found that alcoholics have a lower level of those natural endorphins and enkephalins than non-alcoholics. Now, I don't know if they had that from the beginning and that's what led to the search for the substance, and that would be an interesting long-term study, would be to take a cohort of people, measure their endorphin and enkephalin levels, see what they are, see how many wind up with lower levels in addictive behaviors.
Yeah.
But there are natural ways to produce those endorphins and enkephalins. Exercise is one of the biggest ways to produce them. Hugs produce them. They've done studies where just getting 7 hugs a day increases that level and increases your body's ability to fight off illness. Chocolate. There's all sorts of things that give you, that's just for the chocoholics too. But so we've got to be able to replace some of that stuff naturally.
Nice. And that's a big part of the program over there at One Method Center, right? You guys do mind and body and blend it all together. Yeah,
absolutely. And like I said, it's not talked about a lot in the 12-step rooms. Most treatment centers do at least provide a little bit of exercise, but One Method's model is that that's an inherent and vital part of recovery. And so that's focused on a lot there, along with the mental, emotional, and spiritual aspects.
Yeah, definitely. It's all very important, part of the whole package. So I've heard a little bit about trauma being stored in the body and that the body has its own sort of memory. Do you have any idea about that? Have you heard about that?
Yes, there's a book. I don't remember the author. It's The Body Remembers. And like I said, we store a lot of stuff in our bodies. So somatic experiencing helps to do that. Reiki work helps to do that. There are people, and you may have had this experience or know people, if you go for a massage, a masseuse may hit a certain spot in your body and you could start crying
Hmm.
because they've hit a cell memory of some emotional happening. Um, Exercise helps loosen some of that stuff up. I've done a lot of processing of emotions in the gym because things got stirred up by working out.
Hmm.
Um, it's also why we develop a lot of the physical problems that we develop in the neck, shoulders, back, headaches, gut problems, is because we're storing stress, emotions, tension, and trauma in those places. And the energy of that emotion in that place is going to be vibrating in the cells. And this may sound a little out there, but I apologize for that, Dan.
No, no, no.
And who knows how that's going to develop as some sort of a knot, some sort of a out of alignment. Could it even turn into a cancerous cell at some point? Probably.
Hmm.
Even Western medicine acknowledges that there is a connection between one's physical body and one's emotional body.
Hmm.
Took a long time for that to come about, but
Yeah. When you're speaking of this energy vibrating a certain way, what does that actually look like scientifically? Is that an Eastern medicine thing? How would that be explained in terms of, physical matter? What's going on there?
well, I think it probably is an Eastern medicine belief. I'm not well educated in Eastern medicine, but it's easy to tell because you can feel heat in the body in different
Hmm.
places. You feel tension in the body in different places in different ways. So that energy goes in there. And if you really scan your body, you can tell, like, oh, I'm tensing my shoulders, or my hands clenched. That's how that energy is showing up.
I see. Yeah.
On a cellular level, I don't know the exact scientific ways that you would measure that,
Hmm.
but I imagine it would show up in the same way, say with an MRI, if you stimulated some sort of a memory. Not only would you see it in the brain, but I would believe you'd probably see it in tensing of certain muscles in the body too.
Yeah, that would make sense. Sort of reliving that moment. I
Right.
know a lot of times when they have like combat veterans that experience an explosion or something, they'll develop a tic that is kind of, mimics what they would do if an explosion was going off. So
Correct.
totally makes sense. Um, yeah, it's really cool. So how did you get into the work you do, and why this specific type of work, and why one method?
Well, I've always been interested in psychology my whole life,
Hmm.
and it. I was in nursing school for a time as well, so I'm kind of the guy that gets into the helping profession.
Hmm.
I've had my own struggles with issues, emotional and prescription chemical issues over the years, and just found a calling to this basically, and found that it was something I was naturally very good at and really loved to do, and
Nice,
that's just grown over the years.
nice. Yeah, it's awesome. It's always good. I find that most people that the best in the industry in recovery are those that are like called to it for a higher reason. They want to help other people that have gone through what they have gone through. So
Mhm.
the fact that you can relate to them also probably helps them as well. Um, so let's see. What else do we want to talk about today? Anything on your mind today that you want to talk about?
Well, we could talk about how one reconnects.
Oh, right. That sounds important. Yeah, I should probably
Since
get to
since
that.
my view is addiction is
Yeah.
disconnection.
Yeah, yeah,
Well,
definitely.
okay, now that we know that, what do we do?
Yeah.
Okay, so the EMDR, the somatic experiencing, those kinds of things, they help you work through the trauma and
Yeah.
loosen the trauma up so you're no longer frozen in the trauma. But then what?
Hmm.
And the then what from me, and I start working with people right away as soon as I start working with them on this, whether they're in a treatment center or in my private practice, early sobriety or early recovery from their addictive behaviors, and that is healing.
Mm-hmm.
And the healing comes, I believe, through grieving.
Mm.
Grieving involves tears. And one of the
Okay.
last things people want to do is really get into their pain and cry and have their feelings.
Yeah.
But we are created as feeling beings. Everything about us is really about our feelings,
Mm.
right? The the stereotypical Mr. Spock, Captain Kirk argument was feelings versus logic, right? That was the whole basis of the show.
Right.
And if you're not a Star Trekkie, that's fine. I understand. But the idea is that in that disconnected state, I feel an emptiness, a void within me. In a connected state, that's gone. There is no void or hole in me. That's just an illusion of being disconnected. So how do I get connected? I have to learn to sit through my feelings. I have to learn that it's okay for me to have whatever feeling I have. You know, in Western culture, it's viewed on as not masculine to have tears, to be sad.
Right.
It's viewed on for females. This is all stereotypical, and I apologize for the stereotypes, but it's viewed that women can have tears, but they can't be angry.
Mm.
They're not allowed to have anger. So they're allowed to have tears. Men aren't allowed to be angry.
Yeah.
And what you see is you see a lot of emotional women and angry men.
Right.
But being emotional doesn't mean that they're any more connected to their real feelings than the men are in their anger.
Mm-hmm.
So the idea is to start doing things to reconnect to one's authentic self and to go through and grieve the painful experiences, the wounds. A lot of people who have addiction think that they're broken or there's something wrong with them and they need to be fixed. There's nothing broken. I view it as more being wounded.
Mm.
Whether it's a large wound or a small wound, it's just a wound. And
Yeah.
wounds can be healed, right? If I'm broken intrinsically, that can't be healed.
True.
So the idea that there's something intrinsically wrong with me is not correct. There is something wrong, but the wrongness is I'm disconnected from who I really am. A lot of times you'll hear people say, I don't know who I am. And that happens outside of addicts as well. Happens outside of addiction. People don't know who they are. My view is it's more than just addicts who are disconnected. So it's not just addiction, but I do believe that it is underneath all the addiction.
Well, yeah, people check out in all kinds of ways, it's whether it's TV or, the phone,
Other things,
whatever.
right.
Yeah.
And there aren't billions of prescriptions being written for anxiety and depression because everybody's connected and operating out of their authentic selves. I
Right.
promise you.
Yeah.
So, but we're talking about addiction here, so we can stick to that.
Yeah, sure.
And so the exercises are about slowing down, learning to identify how I feel.
Mm-hmm.
Most people are stuck on happy, glad, I'm good, I'm great, I'm terrible, which aren't really feelings to begin with. They're judgments about feelings states.
Mm-hmm.
So one of the goals of treatment, whether it be just psychology or a treatment facility, is to start to educate people about what are they feeling and help them get a vocabulary for identifying how they're feeling.
Nice. How do you do that? Do you have like a giant list of
I do.
emotions?
I have a whole page with 4 or 5 columns of different
Oh, wow.
feeling words.
I'd love to see that sometime. Maybe we can post it in the show notes or something. Sounds pretty
Okay.
interesting.
because words are very powerful, as you know, and so
Totally.
if I say I feel good, that's a general category that doesn't really do anything.
Right.
But if I say I feel elated, well, when I say elated, certain things happen in my facial structure, in my body language, in just the word elated. There's a elation that comes with that. So if I can start to speak in feeling words, I'm going to experience the feelings more.
Hmm.
Now, all the defenses that I came up with to protect myself against feelings are going to come into play to try to stop me from feeling. But that's what the treatment modalities, like at One Method, that's what the group helps produce. That's what the individual sessions. That can happen through massage, through acupuncture, through working out at the gym. All of that stuff helps because dysfunctional behaviors are feeling avoidant behaviors. They're designed to keep me from my true feelings. If I start acting in a healthy way, those feelings are going to come up and be more available. They're feeling inviting behaviors. Healthy behaviors are feeling inviting behaviors. Dysfunctional behaviors are feeling avoidant behaviors.
So it must be kind of like a snowball at a certain point. You know, the more healthy behaviors you're doing, the more feelings you're allowing to come through and experience. And then again, the healthier you're going to live. And then it kind of self-perpetuates in a positive direction at a certain point.
If people let it.
If you let it, okay.
What happens is a lot of people, and this is why we see a lot of relapse, is they start to do healthy things. They start to feel better. They start to become more open. More of the old pain starts to come to the surface, and they move back into feeling avoidant behaviors to run away from it again.
Yeah. How does one avoid going through that? Is there a way to identify it, or what do you do once you identify it to prevent that from happening?
Well, the idea is to learn to walk through the feeling.
Okay.
So if people are cognizant of having the feelings start to come up, and there's a place for talking about it, sharing it, even being educated about it, they can stay in the healthy behavior, learn to sit through the feeling, and not have to go back to the feeling avoidant behaviors.
Right. That makes a lot of sense.
It used to be that it was thought that you could go to treatment for 30 days. That was the standard, right?
Yeah.
And these days, 30 days just starts scratching the surface. A lot of this stuff at 30 days, you leave treatment, you go out, and all these feelings start to come up. And if you're not connected into a community, if you don't have a good support system, it's overwhelming and you go back to the old behavior or find a new behavior.
Yeah.
That's why a lot of treatment centers now and treatment programs are promoting longer stays. And all the research shows that the longer people stay connected to a program, the better the outcome.
Oh, wow. By a
I'm
factor of how much, do you know?
I don't know, because they say usually to try to stay connected in some form, including aftercare or continuing care where you come back for an alumni group, that can go on for up to a year. That the longer one stays in different levels of care with the program that they've been introduced to, or a program of continuing care, usually they measure it up to about a year. The results are statistically significant better for those who stay connected.
Nice. That's pretty cool.
But I'm working with people who, in my private practice, who have they've been abstinent from the chemical or the behavior for decades, and they're just now getting in touch with their feelings. they live a pretty functional life.
Mm-hmm.
In other words, they're not acting out all over the place and their life's falling apart, but they still don't feel that connection. They still feel off
Yeah.
and uncentered.
I think that's hard because I actually know a handful of people that have gotten clean and sober only to commit suicide, because they still felt that disconnect. And while they were doing everything they could to process whatever it was that was underlying, didn't work out for them, didn't get there fast enough. So I think the importance of that work that you're describing can't be stressed enough.
No, it can't. It also explains why people with decades of abstinence will go back to an
Absolutely.
addictive behavior,
Yeah.
because the underlying feelings will catch up with us one way or another.
Yeah.
Once we've had the feeling, it's in us. Why can't we just move on? Why do we have to focus on the past? You hear that a lot, right? Why
Yeah.
can't I just start over? Well, I can't. I still have all of that stuff in me.
Yeah.
I have to get it out. If I can get it out, then I can move on.
Nice. I know you're a big proponent of meditation as a form of processing. Could you speak on that a little bit? Like what specific style you like and how that plays into this processing stuff you're talking about?
Okay, well, there's a myriad of well-known and well-established meditation practices. There's of course, transcendental meditation that's been around a long time. One of the bigger ones that gets a lot of attention these days is mindfulness meditation or Vipassana meditation. All of those are great, and they all focus on one thing or another. TM, transcendental meditation, you get a mantra from a master that is supposedly supposed to be aligned with your vibration as a human being, and that master picks up on it and gives you that mantra. Mindfulness meditation, where you're just starting to recognize that you have thoughts, but you're not your thoughts. So that's a really good thing, especially for people in addiction. We think that we are our thoughts. Therefore, I must react and act on my thoughts. But if I begin to notice that I'm having thoughts, well, who's the I that's having the thought? If I notice that I have a feeling, who's the I that's having the feeling? If I notice that I'm behaving in a certain way, who's the I that's behaving in that way? And I can begin to separate that there is an I core me that has those things and does those things, but is not a slave to them. Does that make sense?
Yeah, definitely. So there's kind of the I, you, and also the observant you that
Correct.
That wouldn't necessarily be able to articulate that. And is the observant you is more of the real you?
I think so, yes. I believe so. So there's all those meditations. You can look at flames. You can look at any object and focus and concentrate on those. But the processing meditation or the grieving meditation that I developed and have done for decades has more to do with creating a space and a time to be with me and just allow me to be me. And that means allow my feelings to come up, basically invite them to come up. So I create a safe, quiet place where I have privacy, because it's very difficult to start crying out loud and have people come and try to comfort you and stuff. And initially just learn to relax the body to help not store some of that feeling in the body. And then allow our mind to go wherever it goes, because left to itself, eventually our psyches will take us to the place we need to go. It really will. At first, our head that separates itself will be in charge, and we'll just be thinking about everything else. And that's okay, because like any meditation, your mind's going to wander. And in most meditations, the instruction is when you see and notice your mind wandering, gently bring it back to what you were doing. whether it's counting the breath, saying the mantra. In this case, it's let your mind wander and see where it goes.
Mm-hmm.
And when it goes to something that produces an emotional reaction in you, like, ooh, that, then move in that direction towards that emotional reaction.
Mm.
And it's not about digging for old painful memories. It's about allowing them to come up naturally, because it is a natural process and they will come up naturally. I used music as a way to connect with those feelings, whether it was the lyrics or the melody. I had a journal there, so if nothing was connecting, I might start writing, and that might connect me to some of my feelings. Whatever it was, different body positions. This is even before I even knew about somatic experiencing. If I laid one way or sat one way, I would have no feelings. If I changed position, I would start crying.
Hmm.
So the body position just intuitively would lead me to get to my feelings. And the whole purpose is to get to my feelings and through them, get them out of me so that I'm not carrying them around.
Yeah. Lean into it rather than away from it.
Correct.
It's the only way through it.
That's right. Because the only way out is through.
Yeah. Nice. Awesome. Are there any other modalities that you recommend people check out as far as healing this sort of trauma and processing this stuff?
I recommend checking them all out.
Check them all out.
I did many years ago. I did rebirthing, which was a form of well, it depended on what you got involved in. It could go anywhere from just a yogic kind of breathing, that would produce certain effects in the body and the brain and emotional response. I had a very, very, very powerful spiritual experience doing that rebirthing. But they would have people do things like go into a tank of warm water and down through a tube like the birth canal and come out the other side, and people would be there and cheer you on. I think it still may be going on. There's all sorts of stuff.
Is somebody in that room dressed up like a doctor and like also?
I don't know if it went that far.
Nice.
But there's a lot of stuff out there to help people connect to feelings, and there's a lot of stuff out there to help people stay away from their feelings, believe it or not. And emotions and feelings are not necessarily the same things.
Okay.
Feelings come from here, and we have to try to understand them.
From the
lot
body.
of emotions, right?
I see.
A lot of emotions come from our thoughts. In other words, certain thoughts produce certain emotions. They can also produce feelings. If I recall a wonderful, loving time with my son or my wife or my friends, that produces a wonderful feeling within my body. But if I'm thinking scary thoughts, I'm going to get very scared.
Yeah.
Right?
Absolutely. Yeah, that makes sense. So if there's one thing that you could say to people that are still suffering with this sort of thing, what's like the one message you would drive home if you could say it to everyone that's out there suffering?
Get help.
Get help.
Because it's almost impossible to beat this on one's own.
Yeah. Absolutely.
I mean, whatever that help is, just get some help. Tell somebody the truth and get some help.
Nice. Thank you so much, Gary. I really appreciate your time. It's been
My pleasure, Dan.
Really fun conversation, man. Appreciate it.
Great to see you. Thanks.
I'm going to close out the show right now. So for everyone watching, please remember to like, subscribe, and share Recovery X on Facebook, YouTube, and iTunes. We'll leave the links to each of those in the show notes. And if I can get that emotions list from Gary, I'll include that in the show notes as well. I also want to let anyone know who has someone that they love who's suffering from addiction, or if you yourself are suffering from addiction and you need help, you can reach out to us here at Recovery X, and we will connect you with an expert who can help you out right away. If you like what we're doing here at Recovery X and want to support us in solving the problem of addiction, you can donate to the show at patreon.com/RecoveryX. All right, I'm Dan Sevigny, this is Recovery X. Thank you so much for watching. Gary, thanks again.
My
Have a
pleasure.
great day.
You too.
Later, brother.